today we will talk about 3 supplements that may possibly help controlling sugar levels. Number 3 is going to be the most commonly used, so stick around. Now I'm also going to have links in the description so you can check out some of these products if you are interested. Number 1 is going to be aloe vera. Now aloe vera supplements or juices can be made from the leaves. Their leaves they look like cactus, and they help lower your fasting sugar level, and as well as A1C in people who are pre-diabetic, as well as people who have type 2 diabetes. And this couple of research studies done on aloe vera which show that individuals who've had horribly bad sugar levels, fasting sugar levels greater than 200, these results report that the use of aloe vera is good, significantly reducing fasting blood glucose level by 64 points and A1C by even more than 1 percentage point. So this is definitely reassuring. Now, a couple of precautions, of course, you need to take with aloe vera. Aloe vera can interact with several medications, so you have to check with your doctor, of course, before using it. You should never be taken with certain type of hard medication such as digoxin. Now, this has to be kept in mind. Now, number 2 is going to be something that you may not have heard before. This is called Gymnema. Gymnema sylvestre is the botanical name, and Gymnema is Ayurvedic medication that has been used for centuries. And actually, in one study, it showed that people with type 2 diabetes, they were taking around 400 milligrams of the Gymnema extract, and they took this for about 18 to 20 months, and they experienced a 29% decrease in their fasting glucose level, and this is drastic. And they also saw a decrease in their A1C from 11% to around 8%. Now, this is actually an older study, but of course, this is such a drastic change. I think something like this needs to be repeated. However, this has been shown to be definitely useful. Now, there's more studies done on this, and this herb actually showed that it lowered fasting sugar levels and A1C even in type 1 diabetes. And if you have a look over here, so it can actually also reduce cravings of sweets because it actually suppresses the sweet taste sensation in your mouth. So here they say that at the initial phase, after glucose intake, glucose and plasma insulin responses were lower in this group than in the control group. And these suggest that this itself has a substantial role in controlling postprandial gastrointestinal activities, which means that normally your sugar levels may be fine, but when you eat, your sugar levels spike up. Now, this happens in diabetics that people don't actually realize. Their A1C may be within normal limits, but after you eat food, your sugars may spike and you may miss that. And that could lead to development of heart disease and brain disease. So this is basically suggesting that taking this can actually suppress postprandial or after meal sugar levels. And this is highly encouraging. Now, there are a couple of aspects you have to keep in mind, because this can enhance your blood sugar lowering effects of insulin. So you have to do this under the guidance of your physician. Sometimes you may need to titrate or even lower your diabetes medication and your insulin. And of course, one thing to note, I should not forget mentioning this, that Gymnema sylvestre has been known to cause some type of liver damage as well. So of course, keep in touch with your doctor. Now, the last one on my list is actually going to be something that people know about, and this is cinnamon. Now, cinnamon supplements, they can be made from the whole cinnamon, or it could be an extract, and studies suggest that it helps lower sugar levels and helps out with diabetes control. And how does it work? So they say that it may help your blood cells better respond to insulin, basically enhancing insulin sensitivity. Insulin is much more useful, much more active. In turn, this allows your sugar into your cells and lowering your sugar levels. Now, this has been helpful in numerous studies have shown So people who have been pre-diabetic, let's go to this study, that pre-diabetic people are people whose sugar fasting sugar levels can range from 100 to 125 milligram per deciliter, and they took about 250 milligram of cinnamon before breakfast and dinner for 3 months, and they actually experienced an 8% decrease in their fasting sugar levels compared to those with placebo. So this is drastic, and you can read over here as well. In individuals with type 2 diabetes mellitus with fasting glucose reduced by around 12 to 52 milligram per deciliter, and A1C actually also reduced by a good decent amount, not an exaggerated amount, but decent amount. And whereas serum insulin decreased in several studies, not only is it decreasing your sugar levels, but also decreasing your insulin levels. Now, when insulin levels decrease, you also tend to lose weight. So this is definitely helpful. Now, a couple of things I want to mention about cinnamon even further. So when you use this as a sole therapy, in patients who have diabetes or pre-diabetes, cinnamon also has been known to help. A couple of precautions to be taken when you're taking cinnamon, because the common cassia variety of cinnamon contains a compound called coumarin, and a compound like this can be harmful for your liver in high amounts. So there is another variety, and make sure if you get any product for cinnamon, make sure it is Ceylon cinnamon, CEYLON cinnamon. This is much more suitable. So cinnamon is great. You have a look at this study as well. They were testing out Cinnolen. Cinnolen is a soluble cinnamon extract, and it found significant decreases in fasting blood glucose, as well as leading to an increase in the lean mass compared to the placebo group. So this is good news. This is exciting news that you may possibly have natural remedies for diabetes in specific certain situations. Now, do not think again that you could replace your medication, and do not think you can do this unsupervised. You have to make sure you're doing this under the trained supervision. Now, I want to talk about this topic for a little bit, because I recently did have a patient who was taking supplements, and they were thinking that it was going to be helping them out. And her sugar level was actually more than 700. That is an awfully high sugar level. And she said she doesn't like doctors, but she came in with abdominal pain, nausea, feeling run down, peeing all the time. So we all know this feeling, right? We know what happens in diabetes. And this is not intended as a replacement of your diabetes medication. And of course, you should not be listening to a random individual on the internet or on YouTube. And in case you are new here, I'm Dr. Khan. I'm a board-certified internal medicine physician, and here we talk about matters related to living a healthier and longer life by doing the right things. So consider subscribing if this is of interest. So guys, if you think you benefited from this video and you are here till the end, then do please consider subscribing, like, and share this video with your family and friends. And I actually have a video where I talk about the different types of diets you can eat potentially to help out with your diabetes as well. It will be on your screen or in the description below. Let me know what you guys think. Have you tried any of these supplements in the past? What has been your result? Let me know in the comments below. I will talk to you guys soon. Thank you so much.